Tulip Hall, is there any particular place I should be
That's
standing?
fine.
That's fine. Okay, good, good. Welcome, everybody. Thank you for coming. This is the Public Health Preparedness option of the Masters in Professional Studies in Homeland Security seminar. Just to tell you a little bit about this, one of the reasons I'm talking about this is a relatively small crowd here, and many of you know about this, but this is an online program, so we are expecting 10 to 15 people that are out there in the internet land and are going to be participating in this seminar here as well. And then we're also going to be recording it so that we can then post it on our seminar series. Speaking of which, about 2 or 3 years ago, Public Health Preparedness had a seminar series that we had gotten started, and we're trying to get that rejuvenated. And what we're looking to do is to do 1 seminar per semester. So this is going to be our kickoff, and we will then be promoting those through the program, through the faculty, through the students, through a LinkedIn site, and various ways. But we're going to get that started because we think that this is really an important part of what students in the MPS program are a part of and have an opportunity to participate in. If you're not familiar with it, our public health preparedness option in Homeland Security provides an MPS. There's also a couple of graduate certificates. It's 33 credits online, totally online for World Campus students. We admit somewhere around 45 to 50 top-notch students each year. And typically the age is 35 to 40 for average getting started. You're a little bit young for this crowd. They're mostly have had professional experience, law enforcement or military or medical systems. And we give them a pretty well-rounded experience then as well. It is delivered totally online, and it is a Penn State degree taught by Penn State faculty. So check us out if you haven't heard about it. Let's see. Yeah, I think that's it. So it's my real delight to introduce our guest speaker today, really to help us kick off this seminar series. Abiodun Awoyemi and I have gotten to know each other personally over the past 36 hours or so, since I met him at the Harrisburg Airport Saturday night. He spent yesterday at University Park meeting with a number of people there, including folks at World Campus and the President's Office, and Dr. Schmitzwag, also the director of our overall Homeland Security program, and we've got another 24 hours or so of other people that you're going to meet. So we're really delighted that he's here to give us this presentation. It's really a glimpse into something that we certainly don't see and appreciate every day. We've been, over the past 24 hours or so, we've really been comparing notes on the differences between the infrastructure related to preparedness for emergency response. It's been eye-opening for me, and I guess even more eye-opening is just to hear what this young man is really going to do for Nigeria in the plans that he has, what he's already done. He comes to us with not only background in this topic, but also he's a geophysicist, so he's putting that background and energy and resources really into helping to develop this plan as well. So you're probably not the only, you're a unique person also in the Nigerian landscape then as well. And so today we're going to hear about preparedness assessment of mass casualty incidents in Nigeria. So I'll just turn it over to you. Thank you.
Thank you very much. Thank you all. I'm going to run us through the
Oh, before you get started, I got to do one other thing. Sorry to do this. So just for those of you who aren't necessarily familiar, we do have a couple of faculty here, 3 of them now, that teach in our program. Dr. Holloman, Dr. Rudy, and Dr. Gannon are here as well. So they are faculty members in that teach in the PHP program. Chulapal, thank you for helping us get set up and doing this online. He's our instructional designer, largely behind the scenes, makes the program go really well. And Rachel Rager is our administrative assistant. She just left, but there's a lot of other people that participate in this program too. So thank you for letting me interrupt you.
Thank you. Morning, everyone. I'm Abiodun Awoyemi from Lagos, Nigeria. I'm in the Homeland Security program. I'm looking to graduate in spring next year. Here to present you today preparedness assessment of mass casualty incident in Nigeria. We're going to be learning some facts about Nigeria, and then go on to consider how prepared Nigeria is to mass casualty incidents, and we look at some past events and the response to those events. From there, we can look at the gaps in the country compared to a place like the US. And then my vision, which is what brought me into this master's program. Like you said, I'm a geoscientist, venturing into another career, and then we can take questions afterwards. I've had many times, I've heard seen on TV where people say Africa is a country, particularly in this part of the world. But Africa is not a country; it's a continent with about 58 countries in it. So that's the continent of Africa, and you can see all of the countries in it. So that's what it looks like. And the green country there is Nigeria. It's in the western, on the western side of the continent of Africa. So the further west of the country is Ghana and other countries. So zooming into Nigeria, those are the few of the major cities. You have Lagos, Port Harcourt, Abuja, Maiduguri. So that map is actually superimposed on the map of the US. So you can see the landmass coverage of Nigeria over the states, and you have an idea of how big the country is. So let's get to know some facts about the country. Nigeria is a very unique country in the continent of Africa because it's got a very big landmass, 923,000 square kilometers. That's about twice the size of California, if you want to compare it to the US. And the landmass is 910,000 square kilometers. One of the challenges we have back home is the issue of power. While the US boasts of millions of megawatts of electricity, Nigeria as a country, we struggle around 5,000 megawatts, so which is actually one of the challenges causing us to have delayed development. Then Nigeria is blessed with natural resources, gas, petroleum, limestone, and other ones. Unlike the US and other Western countries that are prone to natural disasters, hurricanes, tornadoes, back home, the only things we experience in natural disasters are flooding, and sometimes we get droughts. So I guess that's probably one of the reasons we are a bit relaxed in getting prepared for emergencies, because we don't really get the natural disasters. But when we don't have natural disasters, we have mainly man-made disasters. So in terms of population, this is the interesting part about the country. I was looking at the map of, looking at the population data of the continent of Africa, and I realized that Nigeria is the most populous black country in the world, with a population of 190 million people. And if you look at that list provided on the next slide, you would realize that about 40 of the 58 countries in Africa have populations less than 20 million. And the state in Nigeria alone has more than 20 million people in it, the state where I live in Lagos State. So let's look at the population growth at 20-year interval, beginning from the year 1950. So in 1950, we were 37 million by population. 20 years after, this is a life expectancy map. So up until now, I think we're about 40, on the average of 40 years of age for people in Nigeria. And then where in the US you have 70, life expectancy is about 74. So in 1950, we were 37 million. In 1970, we grew to 56 million. In 1990, we rose to 95 million. Between 1990 and then 2010, we had a dramatic increase. We went to 159 million in increase our population. Then we went on 2030 by projection. We're looking at a country of 262 million. Sorry. And currently, like I said on the previous slide, we are on 190 million population. And by 2050, this is interesting, Nigeria is going to be 398 million. It's going to have 398 million people in it. Does that make that interesting to study as a country? And one of the things peculiar about the country is that you have a lot of immigration going on. People from Nigeria go to all parts of the world. Some looking for greener pastures, and also Nigeria is a country worthy of study. Coming back to the country, how prepared are we for emergencies? This is the map I built, which was one of the things that introduced me to this program. I took a course with a doctor in the Department of Geology, a GIS course. And so this was the project I built on that course in 2013. This map shows the casualties of road traffic accidents in the country. Like I said earlier, why we do not experience natural disasters, the disasters we face back home are purely man-made, and one of them is road traffic accidents. People die daily to avoidable accidents, and at the end of the day, nothing is actually done to save these lives when these accidents occur. So this map was built from the data from the Federal Road Safety Commission, showing the casualties of road traffic accidents in the year 2011. So it was a color ramp map showing this state, Kogi, the state in the middle, having the highest number of casualties for that year. Now, looking at this map, you can see that some states had relatively low casualties from road traffic accidents. But let's superimpose another layer on this map to see how prepared we are in terms of hospital presence in all of the states in Nigeria. First, in terms of hospitals, there are different categories of hospitals in Nigeria. You have the federal-owned hospitals, which are mostly university teaching hospitals, just the way First State actually is. Then you have the state university teaching hospitals, and then you have the private hospitals. So most of the hospitals are actually the government-owned hospitals. So now looking at the number of federal government university teaching hospitals that we have in the country, we have about 19 states with university teaching hospitals. And these are the 19 states. I mean, it's interesting to know that the states, some of the states with high casualty of road traffic accidents have what? They do not have any federal government hospital presence in them. So which is one of the reasons why when accidents occur in these places, I mean, there's no place to take those people to. They are left to die, because help will never come to them. So looking at it, that Kogi, you have, again, one of the problems you have back on, which we'll look at in subsequent slide, is the issue of data. So this data shows that there were 2,294 casualties in that state for that year. But to be honest, there were more than that. There would have been more than that because not all the accidents get reported or gets accounted for. So for the state of Kogi, with all of these details, it still doesn't have any federal government teaching hospital in it, making it difficult to be able to take care of victims from any form of accident or disaster. So again, let's look at our preparedness from the aspect of past events and the responses to these past events. There was an incident in Lagos in 2002. There's this armory, military cantonment, where the weapons are kept. So what happened was there was a fire at a nearby market close to the armory, and the fire got to ignite one of the bombs in that in the armory, and it exploded. And the explosion was felt at kilometers away from that location. So what happened was a lot of people living in the barracks, in the military barracks, they were panicked because there was nothing in place actually, in terms of getting prepared or how to act in the event of an emergency. Everybody went in the same direction, typical to our people back home. You hear people, once you see someone running, you don't even want to know what is happening or what's the cause of the running is. You also run in the same direction. So everybody just ran, and then before they knew it, they were actually running into a ditch, which was a canal, and everybody ran into that canal, and over 1,200 people perished in that canal. There was nothing on ground to have stopped that incident, and the question is, from all of the incidents we are going to consider, in addition to this, what have we done to be able to mitigate such in the future? Let's look at the next incident. In 2005, an unfortunate incident occurred at the Port Harcourt International Airport. There was a plane crash which was coming from Abuja, the Federal Capital Territory, and landing coming towards Port Harcourt. It got to the airport and then it crash landed. There were 108 people on board, 110 people on board, 108 died, and 2 survived. I don't know if you watched American Got Talent. There was a lady on American Got Talent with scars on her. She was one of the 2 survivors of this plane crash. She was in high school then. They were all returning home from school. And what happened? A plane crash landed at the airport, similar to the plane Asiana flight that crash landed in San Francisco Airport in 2003. Then 2013, 302 people out of 305 survived the incident in San Francisco. Well, yeah, 108 died, only 2 survived. Why? Because back here, our response, first, preparedness to prevent accidents is poor. Secondly, when in the event of an accident or a disaster, response to it is also almost void, which was what led to the death of 108 people. Then in 2012, which this incident was what inspired me into pursuing this career in emergency management. A plane crashed in Lagos, just about 5 miles to the destination airport in Lagos. It had 153 people on board. Excuse me, please. There were 153 people on board the plane. It was driven, it was piloted by an American pilot, and it was close to the airport, landed, and at the end of the day, all 153 people died. Why this case is very peculiar is because after finding out, we realized that some of the people, about 80 people out of the 153 people, died to smoke inhalation. Dying to smoke inhalation meant that if they got help in time, they could have been rescued. But help never came to them, and showing again that we don't have any preparedness in place, to be able to respond to any emergencies. Another peculiar thing about this incident was it actually crash landed in a densely populated area, like in a community where people, and normally there should have been help in place. So what if that crash landed in the middle of the ocean? Then we'll definitely be clueless as to what to do in getting the people rescued. Then between 2009 and 2016, this is the very famous one that people know about, the deadly Boko Haram group. They've killed more than 20,000 people, according to the Washington Post. But in reality, probably more than that. Back home again, we don't have data to know the number of people that have been killed. So more than 20,000 people have been killed, and you go to the area where this where Boko Haram had been infesting, you realize that again, first, probably there are no hospitals sufficient enough to take care of the victims of these incidences, and at the end of the day, people are left to die to needless circumstances. Then in 2017, this is also interesting. Why Harvey flooded Houston, and the whole of the world was looking at the flood level. I saw an image of Sam Houston road almost flooded to the signpost. Almost about the same time, Benue State was flooded in Nigeria at about almost the same magnitude in terms of the flood level. But the interesting part is that the people of Houston had shelters, had support from FEMA, had support from the state, had support from other agencies, who came. Some people would go up to their ceiling, knowing fully well that they were going to get rescued from the roof. But to my people back home, help was coming from nowhere. And weeks after, there was still no help. When there is flood, one of the things it does is it exposes the population to infections, cholera outbreak and all. But in this case, because the people had nowhere to go, 100,000 people, they had nowhere to go. Some of them definitely would have to live in their flooded homes because they had no other option, and exposing them more to danger, knowing fully well that even after the exposure, there's still no hospital to take care of them. And the last one was what I mentioned earlier. This is very interesting as well. Road traffic accidents in Nigeria. We have these happening regularly. There's a road between Lagos and Ibadan. It's about 120 kilometer stretch of road, and almost every day. I mean, you can check on, just type Google, type road accidents in Nigeria. You see all sorts of horrible images, that shouldn't be online in the first place. These things occur recurrently, and nothing has been done. I was with Dr. Adeomi yesterday, and then I asked him, because he schooled in the University of Ibadan many years ago, and I asked him that, has it been like this all the years? And he said, forever, it has always been a case of recurring accidents on the stretch of Lagos-Ibadan Expressway. Until today, we do not have any presence of trauma centers on that highway. We do not have any presence of medical facility or anything put in place to even prevent these accidents from occurring. And so these things are continued unabated. So the question is, has Nigeria learned from the past events? Has Nigeria made any changes from past events to be able to make lives safer back home? Well, the honest answer is that no, I don't think we have learned. So what are the identified gaps to confirm that truly we have not learned from this? First, sorry. So what are the identified gaps to confirm that truly we haven't learned as a country? First, we lack coordination of emergencies, in managing emergencies. After September 11 incidents in New York, one of the things that happened afterwards was the formation of the Department of Homeland Security. And this was because it was noticed that prior to the incident, there were independent agencies that had ideas as to what was going to happen, but because there was no synergy, there was no central coordination between them, it was what led to, or what made that incident to occur. So back home, we don't have first the equivalent of Department of Homeland Security to be able to assist us in managing, coordinating emergency management. We have, there's FEMA in the US, we have an equivalent of FEMA back home, which is called NEMA, National Emergency Management Agency, but then they do not offer this umbrella body or capacity to be able to coordinate emergencies back home. So the picture there is showing us an incident that occurred, which occurs regularly in Lagos as well. You have building collapse as one of the major disasters that we also experience. So this building, the building over there collapsed, I think a 2-story building, and you see the way people are, and the building are close to it. People stood a lot of them watching. So we have a lot of onlooking going on in my country whenever there is an incident. Rather than go there to help, rather than go there to coordinate the incident, you have a lot of onlookers putting themselves at risk of secondary incidents, occurring at that scene. So we lack coordination. Also, there is no functioning trauma centers in the whole 190 million populous country called Nigeria. There's this signpost on the road between Lagos and Ibadan showing that we have an accident and emergency clinic in Shagam, just within the road. But trust me, in this clinic, nothing is there to save lives. I couldn't show the picture, of that clinic because it wasn't really, they wouldn't even let you snap it because it's embarrassing to them to know that they put that clinic in there. I mean, the agency responsible, but nothing actually is there to be able to save life. I read in the article, in that reference online, that the unit itself, in the first place, has no functioning ambulance. So what they have is a patrol van, a patrol truck. So whenever there is an incident, they put a stretcher on top of the truck to go respond. So you put a stretcher, and then an accident that occurs, involving about 40 victims, you go with such a truck wanting to save how many people? Just one person? It's a big issue back home. Absence of trauma centers and insufficient hospital beds. This is a known problem back home, and some of the hospital beds that we have are actually not qualified to be called hospital beds. And the reason I'm mentioning all of this gap is to be able to tell that, compare the resources we have back home actually to where we should be. Because Nigeria is blessed. At the first slide I mentioned that we have natural resources. We are the largest oil producer, and we shouldn't be in this state where we lack hospital beds, we have bad roads, and all, which is we're going to see next. Then there's poor education and training in handling emergencies. Those two guys were trying to start the education of training the public on CPR, and you see how people gathered. Again, we are very good onlookers when it comes to incidences. So then we have death of ambulances. So in this incident, the same building collapse I showed to you earlier. A 3-story building collapsed. There were people trapped in there, and what we can see there is the presence of one ambulance. So the question is, would this one ambulance transport the first victim and then come back to pick the next victim? Like, what is the sequence? This is not enough. Lagos State has a population of over 20 million people, and it has only 26 ambulance points. And at every point in time, I can guarantee that each of the ambulance points is meant to have just one ambulance, right? But at every point in time, I can guarantee that there is not, all the 26 ambulances are not working at the same time. Maybe you have 20. So the question is, you have 20 million people to 20 ambulances from the government. Is that sufficient? Absolutely not. So we have this death of ambulances, and then we have bad roads. This is for those who have lived in the country or who used to be in the country. One of the things that would pain them, having to see images or news about the country, the roads, the way the roads used to be in the days of John the Baptist, and it's the same way the roads are, in this present age of time. Can you see? This is a major highway, between Abiodun and Lagos. Meant to be like a federal highway, the one we took from State College to Ashi without any portal, but this is not a portal. This is a sinkhole, in the middle of the hole. And then finally, we have policy issues. The decision makers at the top, they are not really ready to solve this problem. They are concerned with other things, that would enrich them, and they are doing fine in enriching themselves, because whenever they cough, the people in government in high places, whenever they cough, they come to the US, to get treatment for their cough. They won't even use the hospitals back home, to treat their cough. They come here to get treated, for the list of injuries to them, but they leave the rest of the 190 million people to suffer. And again, because of all of these gaps, and it looks as if nobody is really willing to take any drastic measure to be able to come to a solution with it, which was it was then I began to think of causing or leading a change back home in Nigeria. I mean, I think like Dr. Eugene mentioned, that I am a geophysicist, so I'm not trained before now. I wasn't trained to be able to do these things, but then the incident, the Dana plane crash that occurred in June 2012 on 3rd of June, 3:43 p.m. Was what inspired me to begin thinking of how, as a country, we would not continue in this state that we have always been in. So, and then this was the Dana flight crash. I visited the scene of the incident just before coming on this trip, and these are the names of the people who perished on that flight. I took particular interest in one name, a young lady called Adekumbi Adebi. She had a dream. She was just 22. She had a dream of becoming Nigeria's first female president, and she was already on track to becoming that. She had schooled in the UK. She had done a course in Harvard, and then she was home, doing a compulsory national youth service program when she also died on that plane. The question is, such a beautiful soul with such big dream was lost to a needless death first, to a preventable circumstance, and we can't continue like that. So this was what inspired me to begin thinking of a solution for the country. So what I started with was to think of a company that would provide emergency services back home. So I registered this company in 2016, last year, November. It's TNN Emergency Management Services. The idea behind TNN Emergency Management Services is to be able to provide emergency services back home, including carrying out vulnerability assessments. Thanks to Dr. Jim Oliman, I learned a lot from his class, how to carry out that, and then also doing developing emergency response plans, back home. At the same time, training people on how to, act, and to save lives in the event of emergency. So, in the near future, one of the services we are going to add, to our services in TNN emergency management will be to have ambulances running, to complement the number of ambulances in the state of Lagos we are inside. Then, looking towards starting another company, in addition to the emergency management company. Again, I'm not doing all of this alone. Partnering with as many young anyone who is willing and really passionate about causing a change back home. We all come together and then rub minds and see how we can actually foster a change back home. So the other company is TNN Data and Intelligence Services. What we will look at is providing data, making data available for research to be able to understand truly in true pictures what we need and how much we need to be able to meet those needs. The third company, it's CNN Healthcare Services. We're looking at taking over the administration of the local government hospitals that we have back home. We call them general hospitals. These hospitals are in a very poor state. My dad, who is 71 years old, was in the hospital at the time, and a doctor put an eye drop. He went for a eye test and put eye drop in his eye and asked him to close his eye. I think it was dilated or so, and asked him to close his eye for some minutes. To close his eye until he returns. And my dad remained there with his eyes closed, and was waiting for the doctor to come ask him to open his eyes. He was there, he slept and woke up, and the doctor hadn't come. And after some hours, it was past 5 p.m., a nurse just came and tapped him. "Sir, what are you doing?" He said, "Doctor, so asked me to close my eyes." "Oh, the doctor has gone home." Left my dad in that state, a 71-year-old man. I met another lady who said that she had a surgery, cesarean section at the General Hospital in Ikorodu, and after she was opened up, she was left for 3 hours without any care, without being covered up in these same general hospitals. People die to preventable circumstances in these hospitals. So we're looking at taking over the administration of these hospitals and also building new hospitals, equivalent of Penn State Ashi, back home in Nigeria, starting with one and then increasing, and then over time we hope to be able to have our presence all over the country to take care of people's health. And then these things will not be sufficient without us having a transportation service company. And the reason for this company is to be able to provide safe and efficient transport of people from place to place. This is needed because most of the deaths that occur on our highways occur from in public transport buses, and these public buses are driven by drivers who are not trained, who are not certified, by vehicles that are not roadworthy, and at the end of the day, the people die on the road to these bad vehicles and then bad drivers. So the vision behind TNN Transportation Services was born when I took a bus, a 13-hour bus, mega bus, from Chicago to State College last year when I visited. It was a safe and fun trip. And my point is, why can't we have the same equivalent back home? You know, run a safe and efficient transport system back home. So, which is the vision, open to replicate Megabus and Greyhound, you know, back home. And finally, I mean, these things won't be complete if we do not take care of our roads. You saw the road I showed to you, which had the big hole. We're looking forward to fixing this, fixing our roads and also maintaining them over a period of time, such that when we get contracts for fixing roads, we also get the maintenance embedded in the contract. So in the end, we're looking at a country that will be safe. First to prepare to prevent emergencies or incidents, disasters from occurring. We're looking at a country where trauma centers will be well located across the country. We're looking at a country where there will be a number of bed spaces to take care of victims of incidences. We're looking at a country where you go to the hospital and you get quality health care. We're looking at a country where you can, you don't have to worry about whether your driver is certified or not, because you know in your mind that yes, the driver is fit to take you from point A to point B. And we're looking at a country where you can move from place to place, on safe roads and all. So this is the vision I have for the country. I've been following this vision since 2013, following the incident of Dana crash. And up until now, we got one company registered, and we're looking at partnering with, starting with Lagos State as a test, as a pilot case, and then we move on to other parts of the country, and hopefully we can actually influence the western parts of Africa, and then in the near future we can look at Africa in another picture, in a better picture than it currently is. This is the vision I have for my country, Nigeria. And coming back to what TNN in the company name actually means the new Nigeria. I mean, the new Nigeria, a Nigeria where things work, a Nigeria where there's value for life, a Nigeria where we no longer die to preventable accidents or to avoidable death. That is my vision for the country. That is what got me into the master's program in Homeland Security, Public Health Preparedness option, and that is what I'm giving all of my time, all of my energy to see develop. Thank you for coming, and I want to appreciate Dr. Eugene Language, Rachel, who is not here, my friends Itoro, and then my friend Abayomi for the support they give to me presenting this. Thank you very much.
Okay, questions?
I think the situation in Nigeria points out what I've been working on my whole career, which is, as an important component of this, is to bring and establish emergency medicine as a specialty in the country. And it's still, of course, not well developed in Nigeria, but we're working on that from the International Federation.
Oh, great. The country, up until now, Nigeria has no residency in emergency medicine, and it's really poor. I was thinking at the time, I mean, thank God that you are working on that at the International Federation. I was thinking at the time that we could have an exchange program between the universities back home and the universities here, such that our students, some students can actually get to have a residency done here, and then go back home. They will have to sign, because most of them will not want to go back home, but they will have to sign an agreement, such that when they are done with their residency in emergency medicine, they can go back and practice for some years, and then they are free to work anywhere else they want to do. Thank you very much for working to bring emergency medicine back to Nigeria.
And then I have a question. Does Nigeria have a military medical school?
There is a military hospital, but I'm not sure if there's a military medical school.
Okay, because there's opportunity to coordinate some things with the military, because often in a lot of countries that I've worked in that have bad economies, the military is actually very well funded and well supplied. And you can potentially, if you get cooperation from them, you can use them to help manage mass casualty events, because they've got usually good transportation assets, plenty of ambulances, helicopters, and the trick is getting the military to cooperate with the civilian healthcare system.
Well, in that case, that would be really good if we had a military hospital. But one of the problems we have back home, there's one problem which I try not to mention, is the problem of corruption in the country. But I try to avoid it, but So coming back to the case of the military, the funds that should actually, all of the funds that should go to the military, some of them actually end up in individual pockets. So it makes them not as equipped as they should be. I mean, the case of Boko Haram, we have all the capacity to actually have been able to conquer Boko Haram, but because some funds meant for the fight against Boko Haram were diverted. And there was a case on the news where $2 billion, one person diverted $2 billion meant to fight Boko Haram. So there's a lot of issue back home. I know of the military hospital. I know of in the Benue flooding that I mentioned, the military actually set up a small clinic to take care of people. But yeah, they can do a lot better. Had it been, there was no corruption in the system. Yeah, hopefully in the future things will get better as we get on to deal with that other endemic issue of corruption. Thank you. Okay.
So an excellent presentation. I'm a Nigerian. I'm meeting you this afternoon. I mean, very nice perspective as to what the issue is. One question I do have, and I mean, very encouraging to hear when you're thinking along the lines of emergency medicine training for trainees in Nigeria. Another thing that is lacking is trauma surgeons. So in addition to being able to provide emergency care, you lack trauma surgeons. You have orthopedic surgeons who are able to operate in the operating room, but initial stabilization are really lack, and you need training for that. At least I've learned that. The other thing is, a good example of that, there are a lot of physicians, Nigerian doctors who have trained in the UK and the US and Australia, for instance, and South Africa as well. Do you have data? I mean, you could go back and look at that from the Nigerian Medical Association, where they have data on all the medical school graduates, and they can then track where they've all been. And what I've found in my experience in interacting with other physicians from Nigeria here is that we all want to go back and help in some capacity. But I mean, the government should be willing, somebody would have to fund that, right, for people to go back and provide care. For instance, I'm a neonatologist here. I got my training, some in the UK and here. I want to be able to have a way to help child mortality. In fact, that's another problem. Maternal mortality and infant mortality is extremely high. I think it's one of the highest in the world. But there's a way to help that, even from like simple ways to help people on ground. So that's one thing. I mean, as you build your vision and goal is to harness physicians who have been trained elsewhere, who have dreams. But at some point, they're going to be forced to go back. I mean, if I'm old and retired, and I could go back and use my skills to teach, the young people and then help. So that's just one thing. Is it a comment and a question at the same time?
Thank you. I'll take note of that, incorporate it into it. Yeah. And then we look forward to partnering with you as well in the near future. So one of the things we're looking at providing will be to create that ambience where people outside will be willing to come back home, knowing fully well that they are safe themselves, and then they can practice without any policy or any law or any unpleasant environment, to deter them from doing what they know how to do best. Yeah, so I'll incorporate that as well. Thank you very much.
If you have mass fatalities in Nigeria, how do they handle those? Do they just pretty much do a mass burial at the site, or do they really have a way to process them?
Okay, so it depends on where it's happening, and then it depends on the nature of the mass fatalities. For Boko Haram, most of the time, Boko Haram incidents or fatalities from Boko Haram attacks, they just do mass burials for them. The Dana plane crash, because of the bonds of some people, they couldn't recognize them, and they had to, for the ones that couldn't recognize, they did not mass, but they did. It was mass, but not in the same holes for them. So yes, we have mass casualties most times for people, and sometimes nobody comes to claim victims of incidents or disasters. So the government will just go ahead to give them mass burial.
So like families are not able to identify their victims.
Yeah, so one of the accidents that occur, commonly, you have maybe a fuel tanker and then passenger buses, and then they all get exploded, and you have hundreds of people, maybe tens of people, who died to such incident, all burnt beyond recognition. So we don't have DNA bank back home. So nobody is going to go test them to know who is who. So what they just do is to give them mass burial. And unfortunately, there's no data to even know who and who were at that scene. So sometimes accidents occur, you don't know the number of people involved. And that's why one of the problems we have at home is you realize that in an incident, the police will tell you 10 people died. The newspaper will tell you 15 people died. Another news reporter will tell you 25 people died from the same incident. So who do we believe? We don't know who to believe because there's no system in place to be able to tell us truly the number of people involved in such incidences.
For your plan, is it sequential? Does one lead to the other? You want to do you have your emergency services, is that going to lead to the data and lead to that? Or are you possibly working on different pieces of them at different points in time? So maybe you might do the roads first to help pay for the other things because that's a basic thing you can do and start generating income to then use it to fund the other things.
Yeah, thank you for that question. The sequence is to start with. So like one company is already registered, and so on this trip, I got certified to be able to train and teach first aid, CPR, and AED. And I started in London, and then completed some certifications here in America, and then coupled with my degree. So back home, the emergency management service company can really fly and start providing services. So we're looking at starting one after another. Once we are able to record success in one company, we can take the success and then move on to the next. So the next company that will get registered soon will most likely will be the data and intelligence company, because on this same trip, I started in Esri in California, makers of RGIS, and I met with the president and founder of the company, and they offered to provide softwares for using ArcGIS for all of this analysis for free for my company, and also offered partnership opportunities. So with that platform, and that will work more with the data and intelligence company. So we most likely will just register that. Again, all of the companies, I can't be the emergency manager, I can't be the road, I can't be the transportation head, I can't be, so the idea is just to sit to oversee and then ensure that, because it's all in the same vision, so it's just to oversee and get people who are actually experts in certain areas, to do the job, and then particularly those who are outside of the country, like she is, who will be willing to want to come home to contribute, we can get them on board. So.
This may be overly simplistic, but are there seatbelts in cars and seatbelt laws? I'm just curious. Your face.
Okay. So that's a very nice question. Thank you for that. Lagos State government started a few years back, started a seatbelt use policy, where you must use seatbelts before driving. But the population is, I wouldn't say they are uneducated. Some of them are receptive to change. Some other ones are very, very hard, to accept some new process. So they think seatbelt is going to get them trapped in the event of an accident or an emergency. So they will not want to, some will not want to use seatbelts. Some other people will be like, no, this can't, accidents can't occur. Some other ones, when they see a police checkpoint in front, what they do is they just hold it on the side, and then once you drive past it, you release it again. So there's a lot of
people do that here in the United States too, just so you know.
But on the average, so we look at it comparatively. Back home, it's beginning to take effect gradually, thanks to the Lagos State governor, the previous governor in Lagos State, who enforced that law of people using seatbelt. And again, in time past, it used to be just the driver only. The passenger to the side was safe. In the event of an accident, nothing would happen to the passenger. Only the driver needed seatbelt. In quotes, but lately people are beginning to know that not even in front, those at the back should also use their seatbelt. Yeah. Thank you.
So let me just check in. So there was one question that came from folks online. I actually think we pretty well addressed it. The question, Adora, from what can Nigeria do to mitigate these casualties, reduce the frequency? It actually came in a little bit earlier in your presentation, and I think we've pretty much addressed it already. If there's follow-up online, here's Tulipal. We got another one here. How are you raising funding for these TNN initiatives? Is our question from Zena.
Well, thus far, I've used my personal funds, my old salaries, and entire resources to run it. I'm open to partnerships financially. But then I learned from the little business knowledge that I had that some people back home can be very funny with investment in your business. What they want to do is, they bring in money, they become largest shareholder, tomorrow they kick you out of the business. And that's not a problem. You can kick me out, but as long as you get this vision carried on, I don't mind. Just get to put the country in a place where lives will not die to needless death. That's my vision. So I'm very wary about jumping into having particularly local partnerships, because some people can be very funny with providing funds, and tomorrow they dictate to you, this is what you should do, and this is what you shouldn't do. But that's not. So thus far up until now, it's been personal funds, and so the idea again for subsequent funding should be that we make money from these services, we reinvest it into the business and keep reinvesting it. So I might remain this lean or this tiny for some time because I'll keep reinvesting all of the income, not to use it to eat yet. Reinvesting until when it gets to a point where we'll be able to run all of the. But yeah, we are open to true and genuine support and partnership to move forward.
Also, one area to explore would be private sector.
Okay.
In Nigeria, in terms of funds and investing, and if you find a good company, a multinational company or even a local company that will be willing to invest, I think one area I see that should be urgent is fixing the roads. Would be one. That's like almost like a no-brainer. It's fixing the road. The federal roads are in poor shape, and that would reduce the problem of road traffic accidents significantly.
Thank you.
Yeah, I guess along with that, you talked a little bit about policymakers who are trying to fatten, their pockets rather than helping. Have you tried to, work with them as far as funding the government?
Yeah, so I have a dream where after completing my program, I'm looking forward to still getting a degree in public policy that will allow me to be able to relate with people at the top level, speak the language they understand, but not the corrupt language they understand though, but speak the language they understand to be able to affect change from the top. All of these things we want to do. To be honest, we can't do it without the support of government. So we're going to be friends of our government. We are not coming to make them know that the country or they've been spoiling the country. We're going to get them to know that we want the country to move forward. Whatever it is you cannot offer, let's come and then complement, let's come and then support, let's come and provide those services, which is what we're looking at. So for the policymakers, we're going to work with them. We're going to be able to, because we need them. We can't do, you come home with emergency medicine to Nigeria, these people, if they see no reason or if they see no benefit in it or no gain in it, they don't approve it. Without approval from government, there's nothing you can do. It can be tough. So you need them actually, and for you to get them, you might need to speak in language they understand. Maybe take them to lunch or to dinner, and for them to be able to grant you the approvals you need to move forward.
So in the company that you're in now, so are there opportunities to affect their safety there, or what's their status related to mass casualties or safety procedures? Can you reflect upon that? Is that an opportunity place to begin working?
Okay, so I work for a company called Sahara Energy in Lagos. The company has presence outside of Lagos and outside, I think about 5 different countries. So I work as a geoscientist, But interestingly, I've been involved in teaching first aid since 2014, despite working as a so I do it on the other side. So there's a program I'm designing with the HR department to train the entire company in first aid and even get them certified, and also be able to get the company better prepared for emergency. So one of the things I'm doing in my current class with Dr. Gavin is using all of the class assignment actually for my company to develop a training program for my company. And hopefully when I get back home, I'm going to be able to start my charity from home in the company.
Mm-hmm. So just a little bit of background. So you might just orient the people to your visit here to the United States now, because we're sort of, your visit right here is sort of in the middle. But what trainings did you do and are you going to do later on here?
Okay, so I've been out of the country since the 10th of October. I started in London, took a 3-day training with St. John Ambulance in first aid at work. So I got certified with them, and then I came into California, attended a conference of Health and Human Services with Esri at the head office in Wetlands. I was there, I met with Jack Dangerman and Dean, the director there, and I left there for Chicago and got certified with American Red Cross, first as a first aider and then as an instructor to be able to teach first aid, CPR, and AED. Then I'm here today, and then I was meant to have a training with Federal Emergency Management Agency, but they never got back to me. I was meant to have a 2 weeks training with them. I think they were overwhelmed by the disasters that occurred recently. So, and then I live here from California, but taking part in the International Association of Emergency Managers at the conference, attending it from Thursday till next week, Thursday. So I'm taking a training, a 3-day pre-conference training in training school administrators in emergency management. Because back home recently, it has been, schools have been a focal point for kidnappers, for attackers, so the reason for taking the training is for me to go back as well and offer these teaching services to schools at home. And after that, I'm going to have the last training with the American Health and Safety Institute, also a trainer certification training in first aid, CPR, and AED. The whole idea is to be able to teach it back home, get people certified, and also to be able to help both institutions, government, and private bodies, and church, schools, to be better prepared for emergencies. All of these trainings in collaboration with the FEMA trainings that I've done online, the independent courses. I think I've completed about 5 or 6 of them. I'm completing one tomorrow as well. That will qualify me to take the class on Friday to Sunday. So all of the trainings are geared towards being able to render the services, take them back home, provide the services.
Mm-hmm. So it's quite a trip. Quite a trip. Yeah. I want to make sure people knew that. So, and I guess just speaking of the trip, so he is scheduled to graduate in the spring, so we expect to see him back here in Hershey for commencement. May 20th, I think, is the date, but whatever the date is, we'll make sure that we get that. Looking forward for commencement time as well. Good. Other questions online? No?
I do have one question. So I'm not a doctor, I'm not a clinician, I'm a fellow student in the program. Have worked with Abiodun for several semesters now, and I'm Joan, by the way.
I know.
I was not sure. We talk online all the time, but I don't know if I look like my picture because I always change my hair color. But one of the things that is very hard is I want to know what people like me can do to help. I want to know what somebody who's not a doctor, I'm not going to Nigeria next year to provide services, but are there ways we can provide funding? Are there ways we can provide support with, I'm thinking ways our legislators here could get involved with the political situation in Nigeria. Are there ways we can be lobbying for things like that? What can we do that's helpful? Give you a winning lottery ticket? I don't know.
Well, I think donations would help a lot. Even though we are not a non-governmental organizations, which would have made donations easier to receive, but donations, collaborations, coming to take a visit to come see sometimes, so you get a bigger picture of it, and encouragement, just the way you've been encouraging me over the years. For now, those are the things I can actually think of. I don't want to set out as looking for money, because it can be funny back home when it comes to money or having needs. A lot of people will come up with ideas and they are actually looking to enrich their pockets, So you send money to them when they're driving Benz G-Wagon back home, So I don't want to drive G-Wagon with your money, actually, or with your support, but I really want your support. I would actually appreciate, if there are equipment or there are devices. I'm looking forward in the near future to having ambulances, running at home, so getting support in any ways from all of these, government collaboration as well. Those are areas where teaching, providing, like the FEMA training I couldn't get into, giving an opportunity for us to be able to get trained, and take the trainings back home. I mean, these are the things where back here we can get the support and take it back home. Thank you.
So, Joe, just one of the things that this has helped, not just me, but not just interacting with you, but I think one of the things that he's exploring here is their relationships that Penn State can have with folks there as well. So we do have global health programs, which sends people to various places. I don't think Nigeria is one of those. He's going to be back in there. So we've had, some preliminary discussions about how is there a way that we can kind of use that as a case study for our preparedness program or something along that line, so that we can channel some energy and some training energy to support what he's maybe trying to do there specifically as an alum.
That'd be great.
Thank you very much. Thank you.
Thank you.
So just as a reminder, we will